But more, let's speak to Paul Hunter, professor of medicine at the Norwich Medical School of the University of East Anglia. Hello to you, Paul. Thank you for speaking to Paris Direct. Experts point out this is not another COVID, but there are a lot of concerns. There's a lot of misinformation online. Tell us why this isn't another COVID, first of all.
Well, I think the first thing is this isn't a new infection. We've known about hantaviruses since the late 1970s, and we have seen previous outbreaks of the Andes variant of hantavirus. They all ended fairly promptly. I think the issue here is primarily around fact that they were on a cruise ship together, and cruise ships have a reputation for being easy to spread infectious diseases. We saw it with COVID, we see it regularly with norovirus and also influenza. So I think the governments, the WHO, the European Centre for Disease Control and the UK Health Security Agency's assessments that this poses a very little risk to wider communities is correct.
Yeah, and can you tell us more about how this disease is passed on? Normally it's a rodent-borne illness, but we're still investigating the case cluster here, aren't we?
Yeah, no, absolutely. I think the first thing, the vast majority of hantavirus infections are acquired from rodents, either rats or mice, and typically by inhaling the dried excrement and urine that you might get when you're clearing out a nest of mice or rats from the garage. And human-to-human spread has been a bit uncertain. I think there was a substantial review about 3-4 years ago, which concluded that the evidence was not strong that there was person-to-person spread. But there have been some documented outbreaks where it was likely that was person-to-person spread. And interestingly, the risk doesn't seem to be that great. Even within a household, the chances of infecting another person generally was only about 1 or 2%, unless they were sexual partners, in which case the risk increased substantially to about 18%. So you need fairly close contact between people, usually, to spread this infection.
And in this evacuation process, we know about the more than 140 people on the boat before they were evacuations beginning. Health officials said no one was showing any symptoms, but they are getting final checkups before they leave the boat again. But as I understand it, it can take up to several weeks, 6 to 8 weeks, to display symptoms, sometimes shorter. So is there a chance these people could be infected and be leaving the boat because they haven't displayed the symptoms yet?
Absolutely. I mean, typically people get infected in about 2 weeks after being exposed, or they become ill after being exposed. But there have been reports of up to 8 weeks from their exposure. So, yeah, it is certainly possible that we might see a few more cases. But I still think the evidence is that it's unlikely that we're going to see any widespread secondary infections amongst people who weren't directly on the boat. But that doesn't mean to say it's not impossible. And I think that's why that people are taking the precautions that they are doing.
Yeah, and so the sort of resistance we saw from some of the locals in Tenerife, these protests that were happening on the island, the president of the Canary Islands initially saying he wouldn't let the ship disembark. That is fear, but you would perhaps suggest fear not based in science. It's perhaps not reasonable in this case?
Yeah, no. Okay. Absolutely. And we've seen what the process is. We've seen people dressed in hazmat suits and PPE. So the chances of spreading to anybody actually on the island at the moment, it would appear to be remote in the extreme.
Yeah, and when we talk about an outbreak, the word that comes up quite often here is that they're saying it'd be a limited outbreak. I don't know what limited means in terms of a number of cases, a number of casualties. But with this long incubation period, I would imagine that makes it much harder for governments, for health officials to trace this disease around the world. We have over 20 nationalities on board.
Yeah, yeah, but you've got to remember that hantavirus is not an incredibly rare infection.
Right.
There are probably up to around 100,000 infections a year annually around the world, maybe more, maybe a bit less. And even in Europe, we have seen our own versions of hantavirus. There's been a small number of cases acquired in the UK from contact with rats over the years, and elsewhere in Europe. And so this isn't a new disease like COVID. It's one that we've had experience of dealing with. This outbreak, I think, is particularly unusual, not because of the numbers of people affected, but the location on a cruise liner. And I think that's what makes this different to some of the other outbreaks that we've seen, particularly in South America.
And for the people who have been infected, can you tell us a little bit about what their symptoms are, how long they have those symptoms, and how long after those symptoms disappear that they would have to still be monitored?
Right, yeah. Typically, the early symptoms, there's two types of hantavirus. There's a pneumonia type, and there's a hemorrhagic fever with renal syndrome type. The South American one tends to cause the pneumonia, and it starts off like many infections, fairly non-specific, malaise, fever that progresses and progressively gets worse, and then you start getting the symptoms of a chest infection, sort of shortness of breath, cough, that sort of thing. The mortality rate of the South American version is somewhere between about 30 and 40% of people that are diagnosed with the infection. Now, clearly, there are probably many more who have the infection that don't get diagnosed and don't get sick, so that figure is probably on the high side. But we know that people who are over 60 are more at risk of getting severe disease and dying than younger people. And in the over 60s age group, the mortality rate can exceed 50%. And I think that's, to a certain extent, what we've seen here, because often cruise liners tend to have a higher average age group than we would see in the general population.
Paul, you're a professor of medicine, but I'm going to ask you to step out of your domain a little bit, maybe one more towards my domain. One of the issues here that we see with outbreaks is scientific literacy in the public population. And I'm wondering, when an outbreak gets so much media attention, does that do more to help inform the public, or does it rather pump up fears and create hysteria? What do you think?
I think, yeah, it's a bit of both. It's a very narrow line to walk, because certainly you don't want to alarm populations unnecessarily, but on the other hand, you don't want to hide things. And I think the evidence is that if hiding something, hoping it will get better, and then it doesn't, causes more distress in the population, it causes more uncertainty with government and more skepticism about public health if you hide things early. So I think, yeah, you have to be open. And clearly at the moment, in a post-pandemic world that we're living in, every new infection, every outbreak tends to get a lot more media attention than if there was 10 years ago, where we probably wouldn't have seen anywhere near the amount of media interest as we've seen in this situation.
Indeed. Paul, thank you so much for your time. Paul Hunter, professor of medicine, joining us from London.